Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the FIA Group.
Hello and welcome to another episode of our Empowering Plans podcast. My name is Jen McCormick and I'm here with Kelly Dempsey. Say hi, Kelly.
Hi, Kelly.
And we are excited to be joining you through this camera today. We get to add the audio plus the visual. So this will be another exciting way that we can talk with you guys a little bit today. So the topic that we thought would be really helpful for us to discuss today is talking about self-funding generally. And what are some considerations, some reasons, some general characteristics of why an individual or an employer might be contemplating whether self-funding is right for them. And we have some tips, advice, best practices that we're excited to share with you today and hoping that we can explain to you why 2025 is really a good year to not only just have a great year, but really to consider self-funding and why it might be right for you. So let's kick this off a little bit and just talk about overall, when it comes to being self-funded, what does that mean? At a high level, there are differences between a fully insured plan and a self-funded plan. And there have been lots of analogies that sometimes help to explain on a basic level what it means to be self-funded. And we hope to kind of give you that as a platform foundation for our discussion today to really unpack the benefits of why this is relevant, but first ensuring that everyone understands what it means. So when you are self-funded, there are pros and there are cons, the same as there are with the fully insured world. But when it comes to self-funded, it really is the employer's money, the employer's operations, the employer that is on the hook when it comes to funding, hence self-funding. So it really is going to be critical that you understand some of the risks and the benefits in setting up this different types of funding structure. Because as owning a home comes with benefits and risk as compared to leasing an apartment, the same can be true when it comes to self-funding. Self-funding, you can analogize to having and owning your own home. And to the contrast, fully insured is like you're leasing an apartment. And when you lease an apartment, if something goes wrong with a leaky window, you call your landlord. You still pay the same rent every month and they fix the landlord. But at the end of the day, you're still renting the apartment. If it's your home, on the other hand, unfortunately, if there's a leaky window, that's on you. That's something that you have to fix and that you are responsible for, but ultimately you own the home. And we want to make sure when we are converting and talking about moving over to self-funding that there are no leaky windows. We want to make sure that we can explain and outline so that you can mitigate the opportunity to have any leaks within your self-funded plan. So I'll take a breath, Kelly. I'll pop it on over to you. Why don't you give us some highlights and things that those should be who are contemplating self-funding, what might make sense for them to really understand when it comes to the benefits of having a self-funded plan?
Yeah, it's a great question. So I think when it comes to the benefits and one of the things that we always talk about, and when my family, my mother always complains that she says that she can't explain what I do for a living. So I try to explain self-funding at the basic level, but I'm not sure it's quite stuck there. 15 years and I'm still trying to explain it to her. But one of the basics is what law applies. So self-funded plans are governed mostly by federal laws. There are obviously some exceptions when it comes to like non-ERISA plans, but we're going to talk about true self-funded ERISA plans, which is, the vast majority. There obviously are others that are not there, but it applies different laws. So the rules are different, the laws are different. It's generally easier to comply with because even though there's a vast amount of federal laws, when you are fully insured, you're not only complying with those same federal laws, but generally also having to comply with very specific state laws. So your state insurance mandates and things of that nature. So the laws are one of the big differentiators between the two. The other one is when it comes to control over plan design, you have a lot more flexibility. So that's a big pro in the self-funded space, is that you get to decide what you're covering, what you're excluding, without anybody really dictating one way or the other what you must do, other than obviously the federal laws that are out there when it comes to like mental health parity and the ACA. There are obviously parameters and rules and guidelines that you have to color within those guidelines and those lines, but there's still a lot more flexibility when deciding what to cover and what not to cover. There's also better transparency and better access to information. Obviously, there is a big push right now, just overall in the industry as well as on Capitol Hill, to have more transparency. It's been several years. We've had, multiple different laws passed about transparency, but we're still not 100% there. But even as a self-funded health plan, you still should have more access to your data. You get more information. And that helps you guide what you need to cover, where you need to implement cost containment opportunities, where there are programs that can help control those costs, because you can look at all that data. You can look at all your claims data. Obviously, it's generally de-identified, so you're not sure, who's incurring the claims, but you can look at it at a broad scale saying, okay, I have high costs in this area. And just to give an example, and it's kind of going off on a little bit of a tangent, but this is how, if you've heard us talk about it over the past probably 10 years, it's how FIA created our diapers and wipes program, was because we were a young, growing company with a very young population. And I like to refer to it affectionately in 2015 as we had the FIA baby boom. We had like 10 babies born at FIA in 2015. And that was when we realized, okay, we have some big claims costs happening in this area. What can we do to help control those costs? And that's when we again created and designed our internal program that we have related to diapers and wipes to help control and maintain those costs. So we're not going to go too far into the details of what that program looks like. If you're interested, we're happy to talk to you about it at more detail. But that is an example of a cost containment program that we put in place, because that's where our claims costs were exploding. Historically, you look at the trends, there was obviously 10, 15 years ago, people were looking at dialysis claims and how to control their dialysis claims. And then there's obviously cancer and, hemophiliacs and things like that. So there's definitely areas where those claims costs, when they start incurring, there are things you can implement, programs you can implement. Sometimes it makes sense to implement them proactively and have them there as kind of more of a safety net. But then there's also times where you can have to be a little reactive and try to better control those costs as well. So it definitely changes and gives you a little bit more flexibility and transparency with where you're going and what you can do, which definitely helps employers decide and make better decisions on a personal level, as opposed to, just being stuck with, this is the plan that I bought, so this is what I'm stuck with.
Yeah. And, I think that you did a really nice job sort of outlining the why now, the why 2025. There are a lot of new considerations. The price of everything is going up. We're seeing this in the costs of how much premiums and the fully insured side are costing. We're seeing this from not only general medical expenses, but in particular with prescription drugs. The costs are getting very, very expensive, that plans, employers, whether you're fully insured or self-funded, the costs are getting very high. And as we're starting to see these big surges and the costs of everything, that transparency that you talked about, there have been some regulations, but it is uniquely situated in being a self-funded plan to have access to that data. You want to make sure that as these prices are going up, you can see exactly where there's an increase for your particular population. You also touched on that, Kelly, that you can then make some of these customized, tailored, pivot type changes that are unique to the particular employee population that you have. By adding that transparency, you can really help to mitigate what your risk might be, which is something that you otherwise would not be able to do, and instead would have the implication of just seeing rising premiums and rising costs without being able to do anything in particular. The other thing to think about too is that there are so many different options for self-funding. It used to be just self-funded versus fully insured. But when it comes to self-funded, you can see different types of arrangements. We'll talk about stop loss in a minute, but you can have a level funded design. You can have a plan that potentially is part of a captive. You can have stop loss. There are a lot of different ways that can give that increased flexibility, not only in inviting that transparency, but also in the type of design for how your self-funded plan might be set up. So I think that those are the really critical things that are driving employers to consider, is now the time for me to start to think about whether this is the right option for me. So the other thing I think that is important for us to talk about, Kelly, is that instead of just having a traditional in the fully insured world contract that you would sign up as an employer for those services, there are some moving parts. We talked about stop loss a bit. Why don't we talk a little bit about some of the considerations, because there are different agreements and documents and things that must be put into place. And when you're contemplating self-funding, it is important to understand not only what your fiduciary responsibility is as a plan sponsor, but the different contracts and agreements that might be put in place. So I want to talk a little bit about some of the different agreements or arrangements that an employer might contemplate entering into if they're looking at self-funding as an option.
Yeah, sure. So the first one and foremost is when you're deciding, instead of obviously picking a fully insured carrier, you're going to be picking a third-party administrator, sometimes called a TPA. There's also other terms for it. You might hear the word ASO. That generally depends on the size of the third-party administrator and their sophistication level and their different contracts and how they're aligned in the industry as to what might work best for you. But the administrative services agreement is your agreement with your third-party administrator that outlines your obligations as an employer as well as the obligations of the third-party administrator. So that's also crucial to understand, because in the self-funded space, like Jen gave the analogy about the window, you are responsible for participating in the process. So it's more of a collaborative type process, and that's intended to, be a pro, not a con. So some people, if you don't want to do that extra legwork and that sounds tedious and scary, it still might be worth trying it. And you can always go back if you want to change. But that is one of the pros to being self-funded, is that you have that ability and the flexibility to be more involved in the process and help look at those things. So the administrative services agreement is by far the number one most crucial document. You're also going to have other vendors potentially involved, and there's a laundry list of vendors that you might directly contract with or you might be subcontracted with through your third-party administrator, excuse me, including a PPO, so you're likely going to access some sort of network. So there might be a network access agreement that you sign or that you're kind of bound to by accessing it through the TPA. There's the pharmacy benefit manager, otherwise called the PBM, which you might have to sign a separate agreement for, as they're the ones helping control specifically the prescription drug piece of your plan. There's also, like Jen mentioned, there's the stop loss agreement. Stop loss is not health insurance. It is financial insurance for the employer. So that's where what we'll call the insurance piece of self-funding comes into play. The big crucial difference in the stop loss area is that they're not subject to the same health insurance regulations. So stop loss carriers are not bound by the Affordable Care Act and like the NSA and these other things so you have to make sure that your contract with the stop loss carrier takes into consideration those obligations that you have related to those different laws. So it's definitely important to look at that stop loss agreement. And also there's various lengths and terms of the stop loss agreement, and there's various pros and cons. We could do a whole separate podcast on the pros and cons of the different stop loss setups. So it's definitely something to consider and explore. And then you have your other kind of, I would call more ancillary vendors of other entities you might work with. So if you want to use direct primary care as part of your medical plan, if you want to use telemedicine, you might have contracts with those specific vendors. Or if, I'm probably missing them. But again, some of those cost containment programs, if there are specific vendors you work with, there's so many different things out there these days. They're constantly evolving and constantly changing and popping up. But there's likely any type of other service agreement that you have or vendor that you're accessing, there's going to be a service agreement to review and assess and analyze. So lots of contracts to be involved. Most definitely to look at with those. Jen, am I missing anything?
No, that's great. And what? It may seem like there are different moving parts, but the good news is this is a community, and there are lots of experts, consultants, individuals that are able to help to navigate through these different agreements and really help you to understand what makes sense, what you should be considering, what potential nuances or gaps might arise. So that I think that you did a great job highlighting all those things. And just know, don't be overwhelmed. There is help. There is the availability of working with someone to really help you through that process. And as we're about to wrap up here, I do think that it is helpful for us to really highlight best practices or some things that you should be taking away about why now? Why consider self-funding for 2025? And I'll share my favorite first, and then Kelly, I'll let you go second, and then we can wrap everything up. But of course, if there are follow-up questions, we're happy to have these discussions with anyone. But One of the things, and going back to the beginning of our discussions, Kelly, that we brought up was you, Kelly, about 2015 being the year of let's take a look at our population and see what some of these issues that are plaguing our particular population might be and what we can do to potentially mitigate those risks. The thing that we need to keep in mind when we're talking about self-funding and benefits is that this is an employee benefit. And what we really want to do is enhance the member employee experience. And we can only do that by helping to understand what particular needs the population might have. Are there certain benefits that your employees would like to have? Poll the staff, ask, add it to the plan. You have such a unique opportunity here to be creative. It is an employee benefit. Let's make sure that we are treating our plans truly as an employee benefit by giving the employees the benefits they want, the benefits that they need, so that they can have a great user experience that's customized and tailored and uniquely suited for them. So I think that is one of the critical best practices, key components with having a self-funded plan is that ability to really enhance the employee aspect of it. Kelly, what about you? What's your favorite?
I mean, that's definitely one of them. And if anybody has any tips on how to get massages covered on your health benefit plan, I am all ears, because that is the one thing I've been lobbying for a while, and I can't figure out how to get that one covered. But that's definitely probably I think the highlight is that it's the flexibility, it's knowing that you can make it a benefit for your employees and make it make sense for your population, and that might change over time. And that's one of the things that I will say, that I am not somebody who's ever been good with change. I'll openly admit that. Jen has known me for a long time and can probably laugh at that. But you have to look at it over time and look at it how it changes. And that's where the flexibility and self-funding comes into play, is that you have the opportunity to adjust and pivot when you need to adjust and pivot. So if your population shifts of employees, or if you take on a new, say you buy another company and they have a different arm, and right now, say you're a manufacturer and you just deliver, you have everybody working in a warehouse, but then you add a delivery component. Now you've got truck drivers. The needs between people who work in a manufacturing plant and people who work and sit and are sedentary and in trucks and delivering are two very different things. And what they might use and what they might access and what they might benefit from are going to be very different. So you have the ability in the self-funded space to pivot and modify your plan as your population evolves. And that can also include age. Let's be honest, that includes the age transition of as companies grow and evolve and who you're hiring. If you have a lot of young people, if you have an older population, again, a diapers and wipes program isn't going to make sense if your employee population is in, your average age is around 50. It makes more sense if your average age is between 25 and 35. So I think that's just the other draw here, is that you can pivot when you need to.
Which creates cost saving opportunities. So it is definitely, thank you so much, everyone, for tuning in. On behalf of myself, Jen McCormick, and Kelly Dempsey here, thank you for listening to another episode of our Empowering Plans podcast.